Usually when you're a speaker at the end of the day at a meeting, you hope that the audience is still alive. But I think at a TEDx event, it doesn't cost energy to listen, it brings you energy. So it's an honor to be at this part of the show and tell you something about the healthcare model we have in Venlo. This is a picture of me, actually, 37 years and 90 kilograms ago. And I was a very happy kid because I had the best parents in the world. I had great brothers and sisters, but the environment that I grew up in, and look at the gardens in the street where I grew up in, they looked great, didn't they? And what's really important about this garden, to me, to my youth, was the height of the fences around the garden. I could look over them, and I had contact with other kids in the neighborhood, with my neighbors. They were more or less an extension of my family, our neighbors. But when I look at that same garden again last year, it actually looks like this nowadays. So somehow something has happened in society that we have started to build boxes around us and build fences, and there's a lot less contact with neighbors and other people. So society has changed since my youth. I have the honor nowadays, today, to be alderman for the great city of Venlo and to serve the people in Venlo and to look forward, to look to the future and build a better healthcare model for the people in the future, because we have some challenges. I will tell you about those, tell you about what has changed in the new system that we are now creating compared to the old one, but what actually makes a difference for the future is trust. And also the national government has come to the conclusion we need to change things in our healthcare model. Their choices were mostly made based on budgets, money. Our healthcare system is becoming too expensive. We have made some different choices in Venlo. I believe that we have in this country one of the best healthcare professionals in the world. They are highly educated, highly motivated. They really they know what they need to do to provide good healthcare to all the people in this country. But we've done something else. We have created a hugely complex healthcare model in this country. What you see in this sheet is just how the budgets are arranged for mental health care for people under 18 years old. So it's hugely complex. Those same boxes that we have made of our gardens, we have made of the budgets in the healthcare system. And each budget has their own healthcare companies, their own professionals. So it's actually not uncommon that in families here in Venlo, we have over 20 different professionals in one household helping out people in that family with their healthcare issues, over 20. And to make it more graspable, I will show you how someone in the old model, when they had a request for care, what they needed to do to gain access to that care. And I want to explain to you based on two people who live here in Venlo, Mr. Jansen and Mrs. Jacobs. First, I introduce you to Mr. Jansen. He's 74 years old. He is single. He has rheumatic hands, bad knees, and an annual income of about 25,000 euros. Mrs. Jacobs is also 74 years old, has bad knees, rheumatic hands, is single, and has an annual income of 25,000 euros. Take Mr. Jansen, he said, I'm not able to walk anymore to the bus stop with my bad knees, so I want to visit the hospital and I need a pass for the collective transport system, where a taxi picks him up at home and brings him to the hospital. He requested that. And he had to fill out a lot of forms with one target only, to gain like a golden ticket that gives him access to the healthcare system. But he didn't only get a ticket for the collective transport system. Someone in an office far away, who never talked to Mr. Jansen, he made an assessment based on the forms that Mr. Jansen had to fill out. And they came to a conclusion that Mr. Jansen had the right for 1.5 hours of home assistance a week, a mobility scooter, a toilet razor, and yes, also the pass for the collective transport. And it's not surprisingly that with the same characteristics, on paper actually, Mrs. Jacobs got the same tickets and the same healthcare solutions. When we add to that our population is changing drastically, this region, we have what we call the demographic advantage. Compared to the rest of the country, we will go faster than the rest of the country, and that we get more elderly people and yet less young people. The amount of people over an age of 75 years old between 2011 and 2030 will almost double, 92% increase of people over 75. So also the request for care will grow dramatically, but compared to that, the number of people who are in the working force and the workforce are going down about 5%. So despite of the problem with the financing of the healthcare, we get a big problem of organizing it in the way that we used to organize it. So the dilemma is our healthcare system is crashing. It's not the computer that's crashing. It's our healthcare system. And we need to make changes. We need to do it differently. So we said we have to make a new vision and look what's wrong in the old system. And what's actually wrong in the old system is not the expenses, but it's actually that the old system was not based on trust, but based on distrust. If people need care, they need to prove that they are ill enough or that they have sufficient problems to gain access to that care. It seems like we don't trust the people. We don't trust the professionals who are doing the job on a daily basis to make the proper choices. No, someone in an office far away needs to make an assessment. Sorry. So we actually said, let's build a system based on trust and not on distrust. And we got a lot of inspiration from a French philosopher who once said, if you want to build a ship, don't drum up people to collect wood, and don't assign them with tasks and work orders, but rather teach them to long for the endless immensity of the sea. So if people want to sail the seas, they themselves will think about how to build a ship, and the ship will be built, not based on instructions from above. And we translated that here in Venlo to the question, how can we stimulate positive behavior based on intrinsic motivation, instead of preventing people from doing the wrong things based on a lot of bureaucracy and a lot of rules and a complex system. So we actually said a system that's not helping out, we need to change from a system to the human dimension. Let people make choices, not systems. And there are three steps in this new system that we are building, this new healthcare model in Venlo, which are important. The first step is personal attention. That not someone at a distance make a judgment from paper, but let's talk to people. So we made local teams of professionals who at the kitchen table at people's homes have a good conversation with people to clear up what is the actual question here. And if we then have a conversation with Mr. Jansen, we see that he's very sad. We didn't notice that at first, but we notice it now. Well, Mrs. Jacobs is very happy. Now, what makes this difference? These characteristics seem the same for both of them. But Mr. Jansen has just lost his wife. Mr. Jansen is in debt. He helped out his son, who had some problems in the past, and now he's in debt himself. He has almost no social contacts. The only social contact he has is an old friend who lives in an elderly home about 2 kilometers away. So yes, that mobility scooter is really a help to Mr. Jansen. Ms. Jacobs, on the contrary, has a lot of friends, a lot of social contacts. Her children visit her regularly. She still has a small car, so she can drive to locations herself. A completely different life. Yet we gave them the same solutions. So in our new model, we have achieved that we look at the questions people have from a different perspective. Mr. Jansen, who got help from a housekeeper 1.5 hours a week, he actually didn't need help to clean his house. He could do that himself because he was used to helping his wife out with that. But he was happy about this solution because then he could speak to someone once a week. So it was for a social contact. He was actually very lonely. And he needed other solutions too, like the mobility scooter in the past, but he said, I don't need help cleaning my house. If you have a different solution for me to help out with my loneliness, I'm happy. And Mrs. Jacobs, on the contrary, said, I don't need that mobility scooter. I can change my bathroom myself. Why should the government pay for that? But I do need help with cleaning my house because my children live 25 kilometers away and have a busy job. And actually, the reduction in cost for care were about 40% based on the old system, and people were much happier. But there's one significant aspect that we have to keep inside if we want this model future-proof. We found out both with Mr. Jensen and Mr. Jacobs that there's a lot of things that volunteers can do to help them out. Mr. Jensen, for instance, was worried about the maintenance of his garden, which he couldn't do anymore with his bad knees. So he got a volunteer for that, who also helped out with other things. We saw with the mobility, there's also volunteers now driving a small bus in the area, which also bring Mr. Jensen around. But the lives of Mr. Jensen and Mrs. Jacobs will not be stable. There will be new things happening. And if for every change we need to go back to that team, having a conversation and seeing what's necessary, we will create a new bureaucracy, and we don't want that. So we looked at how is our healthcare financed. And our healthcare in Venlo and everywhere in the Netherlands is usually financed by the hour. People get 3.5 hours of cleaning help with their house. Well, all they ask is a clean house, not 3.5 hours of help. But if we pay our professionals by the hour, then it will not be easy for them to work together with other professionals or work together with volunteers because they become a threat for their income, for their jobs. So we created a new model where the professionals and the volunteers are not afraid of each other anymore, but they are really willing to work together because we pay the professionals in advance. If we look at the characteristics of our population, we have many informations about our population. The big data has a lot of information about healthcare problems, age, income, and all kinds of things which define how much care someone needs. And when we compare that with all that data we collected in that old healthcare model, where every minute was registered because of that distrust, to what's actually needed, we can predict with more than 95% accuracy in advance how many professionals we need in each area of the city to cover all the questions that people have on healthcare issues. So if we know this in advance, why not pay the professionals in advance and give them the freedom to make decisions themselves, not to register everything anymore and make professionals' choices based on what they were taught and what they know. And that's the Venlo model that we introduced. Based on trust in professionals, we gain new trust between professionals and volunteers and make a future healthcare model which can still work in 2030, when we have less professionals and more requests. But also the targets from the national government to reduce budgets, in this model, we achieved them. This year even, we had to reduce costs by 10 million euros here in Venlo. And I think we even have more than 2 million euros left over. And people are very happy with the healthcare because that was what was most important to me. Do people, is the healthcare, the support that we provide, does it match what people really need? And one statistic I can show you about that is that the number of complaints, the number of formal complaints, this year has been reduced by over 80%. So people are very satisfied with the new healthcare they are giving. Professionals are very satisfied because they are able to work together. And this way we build a healthcare system for the future based on trust and not on distrust. That's my presentation. Thank you.